Immune, Immune Herbs Botanical Medicine Tutorial. Let's start with Astragalus membranaceus, also known as ginseng for younger people, aka Huang Qi or just Astragalus. Astragalus belongs to the Fabiaceae family. It is a deep immune activator. It is an immune enhancer. It is an immunomodulator. It is an adaptogen. It is used for depressed immune systems during the change of season in traditional Chinese medicine, allergies, autoimmune diseases, and cancers. The roots from 4 to 7-year-old plants are used. Constituents of note are the astragalides 1 through 4. It is also part of the change of season soup, in addition to dang shen and wild yam and goji berries. Borago officinalis, also known as borage, belongs to the Boraginaceae family. Borage is an adrenal restorative. It is indicated in stress, post-cortisone steroid treatment, fevers, especially in pulmonary diseases, anxiety, depression, grief, coughs, respiratory difficulties. The oil from borage can be used for things like irritable bowel, irregular menses, premenstrual complaints, eczema, rashes, and other dermatological issues. It is contraindicated in pregnancy due to the pyrrolizidine alkaloids. Constituents include the leaves, the flower, and the seed oil, and as aforementioned, has pyrrolizidine alkaloids. It does has essential fatty acid, gamma linolenic acid, in addition to other constituents, and can be used as an infusion or as a tincture, and the oil can be applied in various different ways. Cotinopsis pilosula, also known as dang shen, belongs to the Cotinopsis pilosulae family. Cotinopsis pilosulae is a general qi tonic. It is slightly yin as compared to something like ginseng, which is more of a yang tonic. It's indicated in weakened conditions of the lung or the spleen in traditional Chinese medicine, i.e. things chronic cough, shortness of breath, copious sputum, etc. It is also used, as aforementioned in the previous slide, in the change of season soup. It's used as a milder substitute for Panax ginseng. It contains the constituents include saponins and alkaloids. It is the root which is used and can be prepared as a tincture as part of the change of season soup or as in a gram constituent. Echinacea, or the purple coneflower, belongs to the Asteraceae family. Echinacea is indicated in active infections, the first sign of infection, or in chronic viral or bacterial infections. Can be used with mild septicemia, recurrent candidiasis, recovery from chemotherapy, as a prophylactic immunostimulant against colds and flus, even upper respiratory tract. Can be applied topically for things like boils, sores, cuts, or for oral cavity inflammation. It is a powerful, as aforementioned, antimicrobial against viruses, bacteria, and protozoa. It is an immunostimulant. It is an anti-inflammatory. Can inhibit bacterial hyaluronidase, can activate macrophages, stimulates phagocytosis. It is a vulnerary, an anti-tumor, and an alterative. Contains numerous constituents. The root and rhizome and the whole plant can be used. In addition, it also contains traces of pyrrolizidine alkaloids, therefore may have some toxicity, but in general, side effects or caution against are typically in those patients which may have an allergic hypersensitivity to Asteraceae family. Eleutherococcus senticosus, or Siberian ginseng, belonging to the Erinaceae family. Siberian ginseng protects the immune system. It is an adaptogen. It is a stimulant tonic, but better for short-term use only. Indications are for weakness, convalescence, or periods of healing, chemotherapy treatment, prolonged stress, chronic inflammatory conditions, even hyper or hypotension, angina, insomnia. It is an adaptogen, as aforementioned. It's immunomodulatory. It increases performance, all types of performance, stamina, resistance to stress, etc. Note, as far as constituents, it contains erythrosides. It does contain also caffeic acid, which is analgesic, anti-inflammatory, antibacterial, antifungal, antiviral, and an antioxidant. But the erythrosides, the parts used are the root and the root bark. Contraindications in Western medicine, we're just going to skip back, is hypertension in excess of 180/90 millimeters mercury, or in acute infections. Also should not be used for prolonged use because it is a stimulant tonic. Reishi, Ganoderma lucidum, also known as the elixir of immortality, one of the greatest of the noble tree mushrooms, belonging to the Ganodermataceae family. Reishi is a deep immune activator. It is an adaptogen. Indicated for insomnia, paranoid conditions, allergies, bronchial asthma, cancer, AIDS, peptic ulcers, hepatitis, myocardial infarctions. There is almost nothing that the immune system can't affect. It is contraindicated, however, in organ transplants or in severe autoimmune disorders, as its immune function may cause an aggravation to the latter, which again is only speculative. It is also should caution against patients that have a hypersensitivity to molds to prescribing reishi. The active constituent is ganoderic acid, which is a triterpene. Also has lanostains 1 through 7. It is the body which is used, including both the cap and the mycelium. Glycyrrhiza glabra, otherwise known as licorice, belonging to the Glycyrrhiza glabra family. Licorice is an adrenocorticotropic. It is anti-inflammatory. It is a demulcent. It is an expectorant. It is antiviral. It's indicated in gastric peptic duodenal ulcers, chronic gastritis, sore throats, bronchitis, adrenocortico insufficiency. It is contraindicated, however, in hypertension due to the glycyrrhizin, which may lead to pseudoaldosteronism, which will decrease potassium and increase sodium. You can use the deglycerated glycyrrhizin in this as a modality, which would avoid the pseudoaldosteronism. Parts used include the root and the rhizome, and again, it's the glycyrrhizin, which is a triterpene glycoside, which is the medical constituent of note. There are phytosterols also found within the licorice. Moving on to Ligustrum lucidum, or the Chinese privet bush. It is part of the Oleaceae family. Chinese privet is an immune enhancer. It is an adaptogen. Indications for use for Ligustrum lucidum is hypercholesterolemia, hepatitis, neutropenia, as a chemotherapy adjunct, for hypertension, even for Parkinson's disease. In traditional Chinese medicine, it's used as a liver or kidney yin deficiency, which may include things like dizziness, spots before the eyes, so scotomas, sore back and knee, premature graying of hair, tinnitus, seminal emissions, palpitations, or energy consumptions associated with heat. It is contraindicated in diarrhea due to cold from spleen deficiency, or in cases of yang deficiency. The active ingredients or constituents in Ligustrum lucidum, or the Chinese privet, include oleanilinic acid, nugenide, leucosticide, and flavonoids. The ripe fruit is where the medicine is extracted. Panax ginseng, otherwise known as the king of herbs, belongs also to the Eroliaceae family, which, as do all the ginsengs. It is a stimulant. It is a yang tonic. It is an adaptogen. It is, as aforementioned, known as the king of herbs and has been used in Asia as far back as there are records. Said to absorb energy from the earth, prolong life, tonify the five viscera, benefit the understanding, and replace lost chi. In Western medicine, it is a stimulant. It is positive for anti-fatigue, spares glycogen stores in muscles during prolonged exercise. It's adaptogenic in relative balance to the physiology, stimulating only under the challenge of stress. Medicinal ingredients or constituents are the ginsenicides, which are steroidal saponins, and which are extracted from the roots. Panax notoginseng, otherwise known as Himalayan ginseng. Again, also part of the Araliaceae family. It is an adaptogen, first described in 1578 by Li Shizhen, and was said to be more valuable than gold, a premier life preserver and general tonic, building blood and strengthening primary energy. In Western medicine, is indicated for angina, hypertension, coronary artery disease, atherosclerosis, wounds and bruises, even Crohn's disease. In traditional Chinese medicine, for internal-external bleeding, joint pain caused by blood stasis. Contraindicated in pregnancy. In traditional Chinese medicine, patients with blood or yin deficiency. Contains steroidal saponins, flavonoids, polysaccharides. The root and the root bark are where the medical constituents are derived. Panax quinquefolius, or American ginseng, also belonging to the Araliaceae family. American ginseng is an adaptogen. It is a mild tonic and stimulant. May have been used by native North Americans for female fertility. Has been exported to China from the mid-18th century, which has led to overharvesting of the plant. It is contraindicated in pregnancy. In traditional Chinese medicine, it is contraindicated in damp colds of the stomach. It is used, again, as an adaptogen, a tonic, a stimulant, used against or an anti-stress formula. Is inhibitory to the cerebral cortex, stimulates subcortical centers, and it is also hypoglycemic, or probably anti-hyperglycemic. Also contains steroidal saponins, and the one of note is the panaquilin, which is also derived from the roots of 3 to 6 year old plants. Schisandra chinensis, also known as Schisandra or five-flavored seed, belonging to the Schisandriaceae family. Schisandra is an adaptogen used for depression, irritability, forgetfulness, stress, issues with hepatitis, cirrhosis, wheezing, shortness of breath. In traditional Chinese medicine, for lung and kidney deficiency. Constituents include lignans, phytosterols, volatile oils, vitamin C and E, which are derived from the berries. Withania somnifera, or ashwagandha, belonging to the Solanaceae family. So ashwagandha, as aforementioned, belonging to the Solanaceae family. It is an adaptogen. It is an anti-tumor. It's indicated in overactive but debilitated patients suffering from fatigue, emaciation, nervous exhaustion, stress, especially long-term stress, impotence due to devitalization, chronic inflammatory diseases, graying of hair, bronchitis, asthma, cancer, anemia. A great tonic against the perils of Western living, you could say. Contraindicated in pregnancy. It is the steroidal lactone, or medicinal constituent of note is the withanolides, which are the adaptogens. It does have other anti-tumor and cytotoxic components, immunomodulator components. The medicinal constituents are derived from the root, the leaves, and the berries.